The marketplace for us. Today, Michael Finney ties together healthcare, our legal system, and Black Lives Matter.
When you hear of an unfair or untimely death, you think in terms of social justice. But you should also think in terms of economic justice. Sharon Washington Barnes and Charles Johnson don't know each other, but they know each other's pain. Both had loved ones die in medical centers. Sharon's brother, Sean, was 29 years old, an artist, youth counselor, and working his way up the Amazon career ladder when he showed up at an emergency room.
My brother said multiple times, "I can't breathe." And I will never forget these words. This is a direct quote from him. I can't breathe. I feel the blood coming up on inhale and exhale now.
Sharon says, despite pleas for help, Sean Washington died. Charles Johnson's wife, Kira, spoke 5 languages and had a pilot's license. After the cesarean birth of her second son, there were problems. Charles says he and his wife begged too.
The entire time Kira is suffering and her condition is continuing to deteriorate, the thing that she kept saying to me is, "Baby, please stay calm, stay calm." And what Kira knew, even in her most vulnerable state, is that as a Black man, if I raised my voice, if I lost my temper, if I slammed my fist on the nurse's station, if I grabbed a doctor by the collar and demanded that they do something, I would immediately be seen as a threat.
Neither of these cases have gone to court, so we don't know what happened. And this is not a report about poor medical outcomes for African-American patients. That's old news. Study after study has proven that. This is a story about how once medicine failed Sharon and Charles and their families, they then felt like the California court system piled on. Since African Americans are more impacted by bad medical outcomes, they're more impacted by California's malpractice laws. Attorney John Burris explains.
That regardless of what anyone might think in terms of this non-racial bias on its face, but when you look at the overall process, you see that the health care that African-Americans get is substantially less than others get. But more importantly, they had a higher percentage of those people who received medical malpractice who received less recovery for it.
Why? Well, big payoffs are rare and reserved for those who can prove multi-million-dollar ongoing care costs or huge financial losses. A death rarely does that. Pain and suffering, not worth much in a California courtroom. Often, the legal top amount available is $250,000, a cap set 45 years ago. Take a look at this federal government inflation calculator. Input the year, 1975, the dollar cap, $250,000, then hit calculate. If the cap had just kept up with inflation, it would be nearly $1 million more than it is today. That's why Charles signed on as chair of the Fairness Act campaign. The Fairness for Injured Patient Act is an initiative approved for the 2022 ballot. Among its provisions, the cap would be tied to inflation and could be set aside under certain circumstances by judges and juries.
They literally add insult to injury, right? Because not only is this value of human life capped at $250,000, it doesn't allow the family to seek justice.
No amount of compensation and no amount of I'm sorry's will cover how we feel with losing my brother. So it's not about that. It's about creating systemic, long-lasting change for not just people of color, but for anybody.
Once this November election is over, you'll begin hearing quite a bit about medical malpractice laws. I'm Michael Finney, 7 on Yours.